Let's discuss the diagnosis according to 8 principles. Exterior imbalances. In exterior imbalances, the symptoms and signs are manifesting in the channels between the skin and muscles, the Wei Qi aspect, or in the skin, muscles, and tendons. It is always necessary to incorporate other principles into the diagnosis of exterior imbalances, such as whether there is exterior heat or exterior cold, or whether it is an exterior deficient or an exterior excess condition. Exterior imbalances are often, but not always, acute. They are usually caused by invasion of exogenous evil qi. Typical example of such patterns are invasions of wind cold or wind heat. An example of a chronic exterior imbalance is when evil qi blocks the channel. This will result in B syndrome or painful blockage syndrome. The Western diagnosis of arthritis would, for example, fall within this category. Skin disorders are not necessarily exterior imbalances. Eczema, psoriasis, acne, and so on are often caused by blood imbalances and interior heat. This means that they are usually exterior manifestations of interior imbalances. Exterior patterns will usually have little or no impact on the functioning of the Sangfu organs. Next, let's discuss the acute exterior imbalances. The exterior condition will typically be an excess condition. This is because acute exterior conditions are usually due to the presence of evil qi. There may well be a concurrent deficient condition, for example, with qi deficiency, in which case it will be a deficient or excess condition. The symptoms and signs in an exterior deficient condition will be milder than in an exterior excess condition. In addition to the symptoms and signs of an exterior condition being dependent on whether it is a deficient or excess condition, they will also be different if the condition is a hot or a cold condition. Exterior patterns will typically be acute, and there will usually be tangible symptoms and signs that indicate that Wei Qi has been disrupted in the circulation and functioning. When Wei Qi is blocked by exogenous evil Qi, it will not be able to warm the skin and muscles, resulting in the person having chills. The blockage of Wei Qi will also manifest with pain and tenderness of the skin and muscles. Cold in the exterior will often disrupt the Taiyang channel. This is typically seen when there being stiffness and pain in the neck and head. Invasions of cold will block Wei Qi from controlling the pores in the skin. This will manifest with the person either not being able to sweat, excess condition, or sweating spontaneously without this relieving the symptoms, deficient condition. Because Wei Qi is compromised, it cannot defend the body against exogenous evil Qi. This will be seen in a person experiencing an aversion to cold, drought, and wind. This aversion is most pronounced in a deficient condition. The conflict between Wei Qi and evil Qi can generate heat, and therefore there may be a fever. This will be a much more significant when there is exterior wind heat. An important differentiation in Chinese medicine is between the symptoms and signs seen in exterior heat condition and interior heat conditions. A key symptoms when differentiating these two patterns is whether there is a concurrent fever and aversion. In interior heat, there is no aversion to cold while there is fever. This will be the case when there is exterior wind heat. Headaches can be a symptom of an exterior imbalance, but there is a difference in the headaches seen in various exterior imbalances. Invasions of heat in the exterior can manifest with a throbbing headache. This is due to the young expanding nature of heat. Exterior cold can manifest with a tight and tense headache due to cold's contracting dynamic. Invasions of dampness in the exterior yin excess can result in a heavy headache. An invasion of heat in the exterior can cause a person to feel thirsty because the the heat will injure the body's fluid. The pulse in exterior condition will be superficial because there is increased activity in the superficial aspect of the body. The pulse that is felt when there is wind heat will be superficial and rapid. Wind cold will manifest with a pulse that is superficial and tight, while a wind dampness pulse will be superficial and slippery. The strength of the pulse will reflect whether it is a deficient or excess condition. In deficient condition, the pulse will lack strength. Because these are acute imbalances, visible changes in the tongue will rarely be observed. If there are changes, this will manifest with changes in the coating in the front and at the edges of the tongue. We have here the table, differences between the exterior heat and the exterior cold. In the exterior cold, we have the immediate symptoms, while the exterior heat, there is immediate, delayed, or gradual symptoms. There is a strong aversion to cold in exterior cold, whilst in exterior heat, there is no or only a slight aversion to cold. There is mild fever or no fever in exterior cold, and in exterior heat, there is a fever. There is tight or tense headache in exterior cold, while in exterior heat, we have the throbbing headache. There's no thirst in exterior cold, while in exterior heat, there is thirst. There's tight and superficial pulse in exterior cold, while in exterior heat, there is rapid and superficial pulse. Next, the difference between exterior deficiency and exterior excess condition. In deficiency, there is spontaneous perspiration or sweating that does not alleviate symptoms, while in excess, there is no sweating. In deficiency, there is extreme aversion to wind and drought, while there is aversion to cold in excess. In deficiency, there is milder symptoms, while in excess, there is a strong symptoms. In deficiency, there is an empty pulse, while in excess, there is full and superficial pulse. Thank you for your attention.